In this video, I will provide a substantial number of case examples. These would be normal and pathologic examples relating to the gallbladder, biliary tract, and liver sonology. This is the ultrasound of a normal gallbladder. Here you can see the liver to the left and the gallbladder to its right. The fundus and the neck are clearly seen. Take note of the anechoic gallbladder lumen, and there are no echoes within that would indicate stones or polyps. The walls are thin, and there's no reason to suspect acute cholecystitis. Here is a clip detailing the sonographic relation of the gallbladder to the portal vein. This is sometimes known as the exclamation dot sign. As previously mentioned, this is a reliable marker in locating the neck of the gallbladder. The dot is the portal vein and is seen at the left-hand side with echogenic walls, connected to an echogenic structure here, the median lobar fissure, which is in turn connected to the gallbladder. The inferior vena cava is also seen inferiorly. Here, we'll show the median lobar fissure in greater detail. The liver and the portal vein are on the left side, and the median lobar fissure is seen here as a white line or an echogenic line connecting the portal vein to the gallbladder. The Mickey Mouse sign. The Mickey Mouse sign is best obtained with the transducer in transverse orientation below the subcostal margin. The portal vein represents Mickey's face. The common bile duct makes up the lateral ear, and the hepatic artery the medial ear. This is further confirmed by turning on collar flow Doppler, showing flow in the portal vein and the hepatic artery, but none in the CBD. This is a dilated common bile duct. With the collar Doppler turned on, we could see the portal vein demonstrating flow, and directly above, parallel to it, is the common bile duct. This is a patient with distal common bile duct obstruction from periampullary cancer. Now, the common bile duct here was measured to be 1.2 centimeters, indicating common bile duct dilatation. I consider ultrasound as the best modality to image gallstones. In this image, one can see typical gallstones layering on the posterior wall of the gallbladder. These echogenic gallstones also create posterior sonic shadowing, and this is often seen in pigment stones. This is an ultrasound of another patient with a large gallstone. The gallstone is echogenic with posterior sonic shadowing. When the patient is made to move, the stone is also seen to move from the neck to the fundus. This is an example of biliary sludge on ultrasound. The more echogenic sludge is seen layering in the bottom half of the gallbladder, and the typical anechoic gallbladder lumen is seen on the upper half. In a patient with acute cholecystitis, thickened gallbladder walls are seen. The walls here are definitely more than 3 millimeters in diameter and demonstrate double walling caused by edema fluid in the walls. Also evident are gallbladder stones layering on the posterior lumen of the gallbladder. Common bile duct diameter is easily measured on its longitudinal axis. To locate the CBD, find the portal vein on its long axis, and then directly anterior to it would be the bile duct. And one should measure the distance in between the inner walls of the bile duct to measure its diameter. In this case, it's 3 millimeters, which is normal. Again, to measure the CBD, locate the portal vein, and the CBD would be anterior to it, running parallel. Some confusion may arise when the common bile duct is dilated. Now, without color Doppler, the dilated CBD and portal vein would actually look very similar, both with echogenic walls and anechoic lumen, and lie very close together. Now, with the help of color flow Doppler, the portal vein is easily distinguished by having color flow, whereas the common bile duct does not. Another example of portal triad imaging. In the transverse plane, again, the Mickey Mouse sign. Portal vein being the structure posterior, the common bile duct and the hepatic arteries are anterior to it, or the ears. Cholecystolithiasis with bile sludge. Bile sludge is seen layering on the posterior wall of the gallbladder. Echogenic stones with posterior sonic shadowing are also seen. Sludge typically looks like this in contrast to actual gallbladder stones. A large gallstone is seen here, impacted at the gallbladder neck. It is very important to image the gallbladder in its totality to avoid missing gallstones. In this case, a stone is seen at the gallbladder neck, while the rest of the gallbladder is normal. If the sonologist did not pay attention to the neck, this stone might be missed. In some cases, the gallbladder lumen can be completely obliterated and replaced by stones. One would not be able to see the typical anechoic lumen, like in this case. And in these cases, the west sign is observed, which is wall, echo, and shadow. That's the west sign. Wall, wall of the gallbladder, and then echo from the stone, and posterior shadowing from the stone. That's the west sign. Another example of the west sign. The gallbladder walls are moderately thickened. Echogenic stones occupy the whole lumen, producing sonic shadowing. Again, this is the wall, echo, and shadow sign, the west sign. There is no anechoic gallbladder lumen appreciated. Gallbladder sludge is seen completely occupying the lumen of this gallbladder. It is isoechoic relative to the liver. Further near the neck, though, a stone is also seen. A contracted gallbladder is very common in a non-fasted individual. One must always be aware that this often makes the gallbladder evaluation a bit difficult. In this example, anechoic fluid is seen outside the gallbladder. This is ascites. The gallbladder walls often appear thickened in these situations because the gallbladder walls imbibe the acidic fluid. One must not mistakenly interpret this as acute cholecystitis. This is a patient with acute calculus cholecystitis. In addition to the thickened gallbladder walls, one appreciates the presence of free fluid around the gallbladder. This is pericholecystic fluid, and this is indicative of a more severe acute cholecystitis. This is typical acute calculus cholecystitis. One would see the thickened gallbladder walls, the presence of echoes within, indicative of stones. Pericholecystic fluid also is seen. Notice the severe wall thickening in this case. The common bile duct here is seen also, which I think isn't dilated. Here is an example of a gallbladder polyp. Gallbladder polyps look very much like gallstones, but they do not cast a shadow, are attached to the wall, and meaning they do not move in relation to the body position. This is a very common finding to see. This is another example of a dilated common bile duct on ultrasound. One can see the portal vein here, and immediately anterior and parallel to it is the dilated common bile duct. Even without measuring, the common bile duct being bigger than the portal vein actually tells us that it's probably dilated. Color flow Doppler helps in distinguishing these two structures. Sometimes we are lucky enough to see a distal common bile duct stone, and in this example we see a severely dilated common bile duct. On its distal portion, a large shadowing echogenic structure is seen, and this is the distal common bile duct stone. Also seen here are dilated intrahepatic ducts due to the biliary tract obstruction. An amoebic liver abscess is seen in this ultrasound clip. Notice the echogenic outer walls, and within the structure, the fluid is slightly echogenic. This distinguishes an abscess from simple cysts of the liver. Also, on Doppler, there is no flow noted within. This is a simple hepatic cyst. Simple hepatic cysts are thin-walled structures with anechoic or dark contents. This is a very typical image of one. One could only see the Also see the posterior sonic enhancement due to the anechoic fluid within. To demonstrate fatty liver changes, one must evaluate liver echogenicity. And this is easily accomplished by using the kidney as a reference. Normally, liver echogenicity compared to the kidney is very similar, like this image on the left. But when the liver is more echogenic than the kidney, it indicates liver hyperechogenicity, which can be a sign of fatty liver changes. That was the last of my case examples, and thank you for your attention.